continuous improvement lives and dies by data. In order to improve processes in an iterative approach, you need to be able to measure and evaluate how small changes in your operative processes will be reflected in the metrics that you're trying to measure. And one of the things that we were really lacking at Children's was ready access to good, reliable data, and certainly something that could match the pace with which we wanted to seek continuous improvement. One of the things that's very attractive about Adaptix is it's sort of EHR platform independent. So essentially, it's built on an architecture that allows you to access data. If the data exists in your data warehouse, you can utilize it and bring it into Adaptix. The support that we got from the Adaptix team, both on the clinical implementation side, but also on the back end that does all the data engineering, was like phenomenal. They worked hand in hand with our IT specialists on our end. They were pretty realistic about how much resource we would need to devote as an organization in order to provide the necessary data extracts so that they could bring the data over into the Adaptix platform and set it up in a way that the data could just be pulled out regularly every day. So you're always working with, data that's no more than 24 hours old. That whole process was totally seamless. I have never experienced a relationship with a vendor that even comes close to the relationship that we have with the people at Adaptix. The way that they approach their work in supporting our success and how successful we want to be, they're as motivated for us to succeed as we are. But traditionally, the electronic medical record experience is one patient record at a time. It's not really good to look at what is your experience in pediatric tonsillectomy or ear reconstruction. What are all the surgeons doing? Or what are all the pediatric surgeons doing in their field? Or what's the performance of our operating room nurses? Or what's the performance of our scrub techs? None of that data really exists in any useful form in a standard electronic medical record. And so what was so great about the way that Adaptix is engineered and architectured is you can kind of look at the data any way you want. It's amazingly flexible, but it's also amazingly easy to use. One of the very first things that we did was we were looking at trying to decrease the amount of time that patients were spending in the first phase of recovery, so PACU. We as a hospital system actually have 3 different physical locations where we do surgery. And using Adaptix, you're able to look at the differences in PACU length of stay between those 2 different cohorts, people that were using the protocol versus people that weren't. You could see the day that you started the protocol, what would change. And sure enough, we saw the metric improve. At the end of the year, I was hoping for maybe a 2x, 3x, if I was lucky, 4x return on my investment. I think it was like 15x or 18x. And with all these other side benefits. I mean, it's not just about more money, it's about improving the culture and improving your processes and improving your patient and family experience scores and all that great stuff. So that was kind of a game changer, and that has allowed us to engage in conversations about, well, what's the next step for our organization with a product like this?